I knew very early on that I wasn't documented and I didn't quite understand what it meant. It was very confusing to me as a kid because I was constantly having to lie about who I am and where I come from. And I also couldn't tell people what kind of things I like to do or what was going on inside of me. I was told that I couldn't play with dolls and I couldn't wear skirts and I couldn't do any of these things, and those are things that I wanted to do. And I was also told that I couldn't tell anybody who I truly am. So it was just constant navigating and battling with myself. The main reason my parents decided to come to the United States was because my dad was diagnosed with type 2 diabetes, and a lot of the times he had to make the hard decision of either putting food on the table or buying his insulin and his medication. And the idea was that it was going to get a lot better as soon as we arrived in the United States, but of course that was not the case. I work for a local immigrant rights nonprofit organization known as the New Mexico Dream Team. And I have the opportunity to run the LGBTQ department in the organization. We like to call it the UndocuQueer department. And so ever since I started to run this department, my main focus has been healthcare. I remember when I first started to realize that I am queer, it was with my grandma. My grandma would let me wear her skirts. I have a lot of memories of dancing around in her living room wearing this like floral skirt. And I remember when my dad found out that my grandma was allowing me to do this, he didn't allow her to watch me anymore. It's like living in dual shadow. You can't let anybody know that you're queer, and you also can't let anybody know that you're undocumented. So there's a lot of trauma there. And mental health resources are also not available to my community. So what I have been working to do is start a program in which queer and undocumented people can partner up with a therapist or a mental health professional, just have access to those resources. Undocumented people don't qualify for any kind of health insurance. So whenever someone gets sick or whenever somebody needs treatment, we have to pay out of pocket, and it's a lot to handle. Queer and undocumented youth is particularly vulnerable because they're not accepted in their families or in that community for their queer identity. And then they're not accepted or just afraid that they won't be accepted in the queer community. We are building community and we're building safe spaces for people who a lot of the times don't have support or don't have the resources that they need in order to succeed. In addition, we're trying to educate people about immigration and queer issues so that they know how to be more welcoming, more inclusive, and so that they know how to support queer and undocumented people. Just knowing that there's a community and there's people who not only accept me but love me for who I am is just incredible. You know, I didn't have that as a kid. I didn't have that in school. I didn't have that at home. And so now to be able to have that, that's just everything. I get to be part of that change. I get to create these safe spaces for people who are dealing with the things that I dealt with as a kid.